mental fitness. This session has been thoughtfully designed by our president, sir. It's dream project that healthy doctor is the foundation for healthy care. So fitness is not merely about physical strength. It also includes mental resilience, emotional balance, and overall being. The today's theme, what with the collab Pavan and Sri Krishna Garu and President Garu made is the Wonder Woman. Beautiful highlight the extraordinary role played by the women pediatricians in our fraternity. They balance always clinical responsibilities, academics, family, and leadership roles requires remarkable strength and dedication and resilience. Through this session, we aim to celebrate their spirit while also sharing practical fitness strategies that can help all of us lead healthier and more balanced lives. Definitely, I'm confident that today's session will inspire us to incorporate simple, effective fitness practices so that the self care is not a luxury for doctors, it is a mere necessity. So, with this note, I welcome all once again and I hand over to Dr. Vijay Kumar sir to proceed today's event. Thank you, sir. Thank you, one and all.
Uh, uh, program lead, respected Dr. Ravi Kumar sir, Dr. Singaravilu sir, Dr. Anjay Garu, Dr. Ravinder, Ramya madam, and many other who have just joined. And today's moderator and faculty team, Dr. Nilima, Dr. Pallavi and all. The standard statistics textbook, it has 16 chapters. So when in the text they write he and she to mention this. So first 8 chapters are he in that, and the last 8 chapters are she. And then the today's world, they say why first chapters he, why not the first 8 chapters she, and then this thing. And then the adolescent medicine, now the name we mention the he, his, her, or she, that way. It is a very different world to think that way. It's actually every 1 month program. But yesterday, the previous 15 days back, we had a program on wellness, which is also continuing now with Sir Dr. Rafiq sir and Dr. Sundar sir. And the special need, and women are very, very definitely special people. So we thought we will have one extra program on women exclusive within 2 weeks of this. And for that, this program is there on Sunday. Over to all the women here. We men today are here to hear from you. Over to all the ladies and Ravi Kumar sir, program lead. Sir, please unmute, sir. Unmute, sir. Ravi Kumar sir, unmute.
Pranamam to everyone. Traditionally, our wisdom considered woman as a divine source of energy. Modern science, modern science recognizes that energy because it is the mitochondrial energy that is purely contributed by the women. Later, the fitness and energy starts for every child at the home kitchen from the mother's hands. So we are eager to listen to the wisdom of our divine mothers, how to improve our fitness. I request the program team to go and move this program ahead. We are looking forward to this very eagerly. Thank you all.
Dr. Pavan? Dr. Pavan?
Yes, sir. Yes, sir. Yeah. Sir, yeah. Now, thank you so much, Ravi Kumar sir and program lead and Dr. Vijay Kumar sir, the president PATS, and Dr. Sridhar sir and Dr. RSV, my friend. So thank you so much for being with us on this journey. And Now, without wasting much time, I request Dr. Pallavi ma'am to initiate the process and introduce the speakers and also the special guests for today. And this theme has been very well described by our earlier speakers. So over to Dr. Pallavi for a marvelous session.
Thank you, Dr. Pavan. Really thank our President, Dr. Vijay Kumar Garu, and others, everybody. It's really heartening to see the number of men who joined today's program. It's almost half I see. That's really, really awesome. To see that all of you are also interested in women health. I didn't expect this, but this is really awesome. Thank you. So let's start this session today. So it's for women, and let me just start sharing. Just a minute. Yeah. Can you see my slides?
Yes, ma'am.
Yeah.
Yes.
Okay, so fitness for women, that was a thing. So last 2 weeks back, when we had an awesome session on physical fitness activity, Dr. Rafiq sir, so many others had spoken so well, and their journey was so awesome. And what we realized was for women it is so different, and it's so very different. And I thought, okay, we need to have a separate session for that, and that's when this started. That I gathered women to start speaking about this. So this is how it starts. And before we start this program, I invite all the women in this group, all the women doctors, please let this be an interactive session. It is for you, it is for us, not for you, for us, for me too, because even I need to learn a few. And this is a learning journey. Dr. Pavan and others had envisioned this journey of a perfect pediatrician, and it starts not just with mental awareness, with physical fitness, nutrition, and there's so many others dimensions we are going to be exploring in the next few months. And this is just a start. And so the initial start always starts with self-assessment. Where do we stand now? That's where we know where we need to go, our goals, and how do we achieve that. So let's start with self-assessment. So just a quick assessment, just 2 minutes. I really invite everybody take a quick paper and pen and just assess. It will just take you 2 minutes. I'm just running you to 5 questions only. So how many days per week do you engage in at least 30 minutes of physical activity? Say walking, gym, yoga, sports, anything. At least 30 minutes. How many days per week? So you get 0 points if it is 0. It's perfectly okay. Nobody's going to see these things. It's only for ourselves. It's only self-assessment, just to see where we stand and where we lie. That's all. 1 to 2 days is 1 point. 3 to 4 days, 2 points. 5 or more, 3 points. Okay, I'm on to the next question there. How would you rate your energy levels during a typical workday? So often exhausted, 0 points. Low energy most of the day, 1 point. Moderate energy, 2 points. High energy most of the day, 3 points. Do you experience neck, back, or joint pain related to work posture or long hours? Daily pain, 0 points. Several times a week, 1 point. Occasionally, 2 points. And rarely or never, 3 points. So if you see, all of these questions are related, we have kept only for women. So these are all so specific and important, which we do not normally address. Thinking fitness is all about, running marathons or miles. No, it is not that. We need to know how physically fit we are in our daily lives. So how is your sleep? So how many hours of good quality sleep do you usually get? Rate yourself. Less than 5 hours. We pride ourselves to, work more and sleep less. But is it really? We will talk about that at later sessions. But right now, let us just assess. Less than 5 hours, 0. 5 to 6 hours, 1 point. 6 to 7 hours, 2 points. 7 to 8, 3 points. And the most important, how often do you practice stress relieving activities? Exercise, yoga, meditation, hobbies? Rarely or never, 0. Once a week, 1. 2 or 3 times per week, 2 points. Most days, 3 points. If you're all done with this, here is the scoring interpretation. So total score is 15. We have 5 questions, so 15. Now, 0 to 5 means it needs immediate attention. Fitness and recovery really need improvement there. 6 to 10, and most of us usually fall in this category. My fitness level is 10, just for telling you when I ran through this test. Some healthy habits present, but consistency needed. I got that. 11 to 15, good fitness level, strong lifestyle habits are already supporting your health. Awesome, great job. Keep going. So, if you're done, I would really love to all of you to post in your charts what was your score. Don't worry about others doing that. It is just about us sharing among ourselves so we know where we stand and where we are going. That's all. A quick shout out there. Palak 12, Anjali 12, Ramya 14, awesome. Oh, we have already awesome men, 9, Manisha got that. I'm 10, by the way, yeah. Okay, awesome. So now, let's now start this journey. Okay, so let me now first welcome our first speaker, Dr. Amrita. So Dr. Amrita is a lifestyle medicine consultant and a health coach. She's a certified menopause coach, certified in CBT too, and has been having 25 years of experience both as a senior anesthesiologist and a lifestyle medicine consultant. She practices both in UK and in India. She is an ambassador and chairperson of PAN, Physicians Association for Nutrition, India, Hyderabad chapter, with so many affiliations, and she's really enthusiastic about spreading awareness and promoting healthy lifestyle. So, Amrita, good morning. Hi. Can somebody spotlight on Dr. Amrita? Satish, maybe?
Hi, good morning, everybody. Thank you, Dr. Pallavi, for inviting me.
Ma'am.
Really excited about this. Looking forward to interacting with everyone.
Yes. Hello. Thank you so much for being here with us today. And so let me ask you a question, Amrita. Like, we're just starting this journey here. You have seen the scoring systems that I have placed here, a simple one. So how would you think physical activity, how important is physical activity for women, and what does it mean physically? What is physical activity? So we are all very active. We are all working women. We are doctors managing life. So I think we are already too physically active. Isn't it so?
Well, in that sense, we are, because, we are doing things as clinicians, as doctors. We are seeing patients, we're doing the ward rounds, and, those who are surgeons may be doing surgeries and all of that. But when we talk in terms of health or lifestyle, when we talk about physical activity, it is a structured physical activity. So do you keep time aside to do a particular type of activity? That is what we are talking about. Everything else that we do apart from eating, sleeping, and that, so the energy which is consumed in that, and our structured physical activity, everything else comes under non-exercise activity thermogenesis, so which I will talk about a bit later. So when we talk about structured physical activity, it can be in the form of aerobic activities like running, dancing. It can be your resistance training, which includes your strength training, a bit of yoga, maybe for flexibility, balance. So it's a combination of different things, and different people like to do different things depending on what suits them, what kind of what activity they like. And the general recommendations from lots of organizations regarding how much physical activity we should do is, if you want to just maintain a healthy weight, you already have a healthy, your healthy weight already, your BMI is okay, and you want to just maintain the healthy weight, then about 150 minutes of moderate physical activity per week. And that can be divided into 5 days. If you can work 7 days a week, that's fine. You divide it into 7 days, or even if you can do 4 to 5 days a week. And moderate physical activity is when your heart rate will increase a little bit, your breathing will be a bit faster, and you will be able to talk, but not necessarily talk in full sentences or have like a full conversation. And apart from the aerobic activity then or other forms of activity, you have to do strength training or resistance exercises for about 2 to 3 days a week and having a recovery period in between. So say alternate days a week, you could do resistance training for muscle strengthening and for bone strengthening. So that is roughly what we should aim for.
Got that. Thank you, Dr. Amrita. I'll come back to you later again. So I want to invite our next speaker. Thank you. So now let's invite Dr. Pooja Manoj. Please spotlight Dr. Pooja Manoj. Hi, Dr. Pooja. I am not able to see.
Sorry. So good morning, everyone.
Yeah.
Can you hear me?
Hi. Yes, I can.
Good
I'm not
morning.
able to see you though. Yeah, you can see you now, right? Hi. Thank you for taking time off today to be here. So Dr. Pooja Manoj is an international board certified lifestyle medicine professor, lifestyle medicine educator from PGDLM, CMC Vellore. And she's a clinical dietitian, certified diabetes educator. She's also done her stint from American College of Sports Medicine. She also teaches Zumba, Kids Zumba, Aqua Zumba, strong nation instructor too. And she's a functional strength training specialist. She is also in the faculty for the event, the happening soon next, I think day after tomorrow, right, Dr. Pooja? At CMC
Yeah.
Vellore. Yeah, I'm up with the neonatologists. CMC Vellore and neonatologists have teamed up to find a lifestyle medicine workshop, and she's in the faculty there. But she was gracious enough to accept that, to do this session today for us women here. Thank you so much, Dr. Pooja.
Thank you, Dr.
So,
Pallavi, for having me here and the PATS team. Looking forward to it.
yeah. So let's start with our first question, Pooja. Here I'm putting it up. If you would like to share your slides, I'm okay with that. Otherwise, we'll
Yeah.
go with this.
So,
Okay. So
I think you'll have to make me the co-host then in that case.
just a minute. Satish, isn't Pooja co-host? Please, can you check that?
Yeah.
Wait a
So
minute.
Yeah.
Satish?
Dr. Pawan sir is having access.
Pawan.
Dr. Pawan, you can make. Yeah, you are the host now. Yeah.
Hello, sir. Hello.
Pooja madam ne host చేయండి. Host చేయండి.
Sir. Satish.
Sir, you only have the
Pooja
access.
madam co-host, sir. Pooja madam co-host unnaru. Yeah.
Yeah. Right. So how should exercise prescriptions be adopted, for different women across life stages, early career, pregnancy, postpartum, midlife, menopause? So the women go through all of that, not just a straight up or down, So considering both physiological changes and the evolving demands of life. I'm stopping share here. Pooja, you can share.
Yeah.
Right.
That option is not coming yet. You stopped sharing?
Yeah, I stopped sharing.
I'm not able to see my screen in the. So I think you can share the screen rather.
Okay. Would you like me to do that? I'll do that then.
Yeah.
Shall
Yeah.
I? Okay.
మేడం టర్న్ ఆఫ్ ఏమైనా చేశారా మీరు?
Yeah. So how should exercise prescriptions be adapted for women across different stages of life, considering their physiological changes?
Okay. So exercise prescription for women, it should reflect the how across life stages, what all changes are happening to women. So like hormonal physiology changes as we age, the metabolic health changes, there'll be musculoskeletal changes and independence in later life. So it should reflect all those changes. Like in 20s and 30s, I'm not able to actually see the, 1 second. So in 20s and 30s, there is peak estrogen level and the muscle is at peak. So muscle building capacity is peak because estrogen is at peak. So the exercise should reflect that. I mean, because we have more potential to build muscle, so we can do resistance training. So aim is to build peak muscle mass so that we can be comfortable at later lives. There will be a lesser risk of fractures, and it will lead to independent living in later life. So we should be doing, we should build a good aerobic base. We should have good muscle mass. We should develop good muscle mass at that point of time. And so the exercises like high intensity interval training, weight training, 2 to 3 days a week, like Dr. Amrita said, and plyometrics, like the explosive jump movements. We should learn the basic movements, learn the basic form, and develop a good fitness level at that point of time. And so later, when preconception and also focus is on core stability and pelvic floor strengthening. And at that point of time, whatever metabolic adaptations you have built, maintenance is the focus at that point of time. And similarly, in the pregnancy time, the ACSM and ACOG recommends, like if you've been doing exercise, you can continue the exercise. But don't take up a new activity. Don't focus on building this thing. Just a baseline fitness, whatever you have built, you should maintain that at during the pregnancy. Focus on breathing exercises, core stability. And after first trimester, ladies should avoid the supine exercises because the cardiac output increases, blood volume increases, and the laxity of the joint happens because of the relaxin. And post-pregnancy, after 6 weeks, there should be gentle movements, maybe gentle walking and all. And after 6 weeks, you start again developing fitness. The pelvic floor strengthening exercises, core stabilization, aerobic, again aerobic training and all that can be slowly started, and progressive resistance training again comes up. And later in life, like when hormonal fluctuations start after 40s, perimenopause period, the body composition is changing. There is fat redistribution. So again, because anabolic resistance is happening, so need to build muscle mass because a small amount of resistance. So optimizing your protein intake, optimizing your diet, all that has to be taken into consideration. And similarly, at old age also, again, building muscle mass, 2 to 3 days of progressive resistance training, 2 to 3 days of weight training, flexibility, mobility exercises, all that should be there in the routine.
Got that. So on to the next question, Pooja, I got that. And what weight management strategies are most effective for women in their 40s and 50s? Now, you talked about high intensity training and strength training in young women, but would you advocate the same for women in 40s, 50s, and beyond? And how can they best address the challenges of abdominal and visceral fat gain?
So for women in 40s and 50s, again, because anabolic resistance is coming up, and if there is a good fitness base, they should continue to build the progressive resistance training is important because of this anabolic resistance, the stimulus has to be stronger. So you only have means you have to become strong enough so that you combat that. So of course, resistance training will remain a part and parcel of the program. Like again, you can do upper body, lower body, alternate days, 2 to 3 days, or you can do a full body training 2 to 3 days, and movements such as, I think you can move on to, okay, this slide only. So movements such as compound lifts, where multiple muscle groups are involved, the lower body muscles, because the legs, we have more muscle mass, the glutes and the hamstrings and the quadriceps, these are large muscles. So we should do lower body heavy lifting is important. But before that, a fitness base is important. Usually women, they start dieting or fasting and all that without a proper, and maybe cardio, but no strength training. So that is actually counterproductive because women will lose muscle mass. They will lose muscle mass after 30, 40 years of age, more so when they are sedentary. So in spite of, a moderate calorie restriction along with resistance training will remain. And also the meal should be circadian aligned eating, means front loading the calories, eating a heavier breakfast with optimal amount of protein and fiber and all the nutrients, and finishing dinner early so that you have enough time for digestion. Sleep becomes very important. So all these things have to be taken into account. Mobility, flexibility, stress management, sleep management, everything becomes important.
Got that. So, so exercise, you would say it's a smart training for midlife. It is not just doing any exercise. That's what I understand from what you said, Pooja.
Yeah. So metabolic, doing lots of marathon training only without optimizing your strength, or maybe doing heavy group classes, because especially for women who are um, like who have already a demanding career, and also because the women will also have the personal life challenges also they will have. So again, exercise is a stressor, so it has to be optimum. So 2 to 3 days of strength training, 2 to 3 days of cardio training optimally is important, because adding unnecessary lot of metabolic training, high intensity training every day, that will be counterproductive because of so much of stress to the body. So it has to be smart. 2 to 3 days of strength training, 45 minutes to 1 hour, or even 30 minutes. So the minimum time is 150 minutes for getting all the health benefits. 150 to 300 moderate intensity training. And also some women will be more energetic during the first phase, the follicular phase. So maybe high intensity training towards the follicular phase, and maybe moderate intensity training towards the luteal phase. So this is how training should be adapted according to the cycles as well.
So very well said. I was about to ask you that question too, Pooja. What about you, like you said, the pre-luteal phase, etc. So totally. So during the pre-luteal phase, you go for high intensity. You're saying luteal phase, you tone down, and then again you can pick up later, right?
Yeah, but it's not the same for everybody. Some women will be okay doing the same same type of workout throughout. So it's just very personal. If you feel that energy is good, you do it like that. There are no recommendations like that you have to do it like that.
Yeah, this is
The
where
general recommendations are
yeah,
same for everybody.
a very tricky question, tricky here, not to understand that hormonal changes so and so different for different women, and yeah, the way they face their cycles, and everything goes by that. That is something that I really want to say for men here and for women. I think men may think, yeah, this is all in the head for women and all that, but it is not. It is simply not. I think all women in this group will agree to that. Hormonal changes rule our lives. We know we get to. It's not about making an excuse. We all want to
Ma'am,
do our
Pallavi
best.
ma'am, full screen cheyara? Sir, full screen.
Oh, is it not on full screen yet? Okay. Just a minute. Can you help me with this, Kar? Am I doing this? No, I'm not able to get that, Pavan. Can you tell me which?
Dr. Pallavi, it's there on the top.
I think I
Make
got it right now, right? Does this show?
No, it's gone. There was a thing at the top which says use slideshow.
Just a minute, I'll stop sharing and restart again. Does it show now?
Yeah, it is. Yeah.
Is it full?
Yes, it is.
Okay, yeah. Okay, so yeah, it's so important that we focus on how our energy level, and I think that tells us our body itself speaks to us, tells us which part of the cycle you're in and how much you can handle that day. If we are open to that, we can actually tailor our own fitness regime, and it is individualized. I think every woman should have his or her own his not sorry his her own prescription for this. And so, yeah, please take away all the messages that everybody is telling us. So we're going to stay tuned to the end. We're going to have the prescription at the end of the session today. Got that. Thank you so much, Pooja. Now going to the next question. So to what extent, 1 minute. To what extent should exercise prescriptions differ between men and women considering the hormones? This is one important critical question that, I really was wondering if you could throw some light on. With recovery patterns, the hormonal environment, the musculoskeletal physiology, how is it different from men, women?
Okay. Men have more testosterone, so they have more muscle building capacity. Women have more estrogen, so at that point of time, it is good. You can build more muscle mass and all that. And estrogen also supports recovery, fat use. And so when there is peak estrogen levels, that is better fat optimization and repair is happening. And women have more type 1 type fibers, which are more endurance. So they are able to do higher reps, they recover faster, and they need shorter rest periods. But of course, cycle may affect for some people. Some people may have a lot of dysmenorrhea and they may be very uncomfortable at that point of time. So as we already discussed, this exercise has to be designed according to that. We have to according to our energy levels. And also women may have higher risk of ACL injuries, knee injuries. Women should focus more on glutes, hip, knees, the compound movements, and they should add balance and stability work also. And as age, like redistribution of fat happens, we need to focus more on strength training, building a good fitness schedule. Strength training becomes crucial. So again, the prescription is same. For some, anywhere between 2 to 5 days of strength training is what is advisable. The key recommendations are same for both men and women, but we have to optimize according to our life stages, our lifestyle, like life responsibilities, etc.
Do you have any exercise recommendations? Can you share with us something that with you telling us we are more prone for injuries, ligament tears, etc. And yeah, like you said, when as the fat mass changes, depending upon each exercises, do you have any recommendation? Can you share some?
So exercise, yeah. So or you have to start slow and build up. Only then you cannot just one day you decided to exercise and you start going to high intensity classes, or you start lifting heavier weights. So that is a perfect recipe to get an injury. So you have to build a fitness level. You start, suppose if your body's composition, fat mass is high and all that. So you start with walking, immediately loading the joints and all that. That will definitely start walking on the treadmill, speed and all that. That will lead to injuries. So first, build some strength. Start with body weight exercises, then move on to resistance bands, slow weights. So progressive nature you have to have. Build a basic strength. So anywhere between 6 months, you take building good fitness levels and strength, and then you move on to more. That is the way to avoid injuries. And of course, sleep is very important, and nutrition is important for preventing. So enough nutrients, vitamin C, etc. So that eating lots of vegetables and fruits, and 8 hours of sleep. If you sleep less and exercise, then that also will lead to injuries.
Okay, got that. On to our special guest now. Pooja will come back to you again later. I want to really introduce our guest here once to everybody here. So here is our special guest for the day. She is Dr. Palak Parin. I will please highlight her once. Please spotlight her once. So while she is a functional and lifestyle medicine consultant, she was and is, I believe, a critical care consultant before this. Now, presently, she is the owner of Shubham Lifestyle Medicine Clinic and the co-founder of Niranjanaya Center for Lifestyle in Gujarat. So let me now introduce Palak. Let us listen to her story. Hi, Dr. Palak. Good morning.
Yes, thank you, Dr. Pallavi, for such a nice introduction.
So we are really waiting and looking forward to hearing about you. So in brief, so Palak has really conquered her and mastered her health through different lifestyle changes that she has adopted. And yeah, I think I leave it to you, Palak, to talk about it. So what
Yeah.
was your journey? Please do share.
First of all, thank you very much for inviting me. It means a lot to me. And thank you everyone, all the ladies being here on a Sunday morning. It's a tough job, you know. So okay, let's take a little break. I would
So
like to tell you one a story. And if you really want to visualize even better, I would suggest to close your eyes to for uh, better emotional attachment to this story. And even I would like to share a picture. Can I just share my slide here?
Yeah, which one would you like to share?
The second last, I think. Second,
Okay.
third last, maybe.
Yeah.
A picture of a girl.
Yes, here. Can you see? No.
Please share the screen, ma'am. Yeah,
One
stop
minute.
the screen sharing.
Yeah.
No, next to it. Yeah.
Yeah.
Yes. So, can you all see this girl? Just look at that girl, and then you can just close your eyes or take a break or take rest while I'm telling you a story. There was a girl having and number of dreams in her eyes, and she was a scholar. She got admission at Asia's largest medical hospital. She topped the nation during her critical care fellowship after PG studies. And as an intensivist, she had a promising career. And she worked in a cardiac hospital. She was earning handsome and achieved her professional milestones, yet a quiet dissatisfaction lingered within, an emotional turmoil of not curing any patient while handling acute emergencies. Then the greatest teacher called life took an unexpected turn. One fine day, she woke up with acute pain in trapezius, paralysis with loss of sensations in her limbs, and debilitating brain fog. She was found to have multiple sclerosis later on. So, in the midst of uncertainty in her life, a book named You Can Heal Your Life entered, written by Louise Hay. It sparked a profound shift in her mindset. She stepped out of medical hospital duties and enrolled in a lifestyle medicine ACLM course from Harvard University. Applying those principles to her own life, she experienced a remarkable recovery. And what began as a personal battle transformed into a powerful mission to heal, to inspire, and champion the science of lifestyle medicine. So, this is my journey from intensive care to inner cure. And what all that ma'am, Dr. Pooja Manoj suggested before, I was practically doing nothing in my life, nothing during my critical care career. So it was horrible. Yes, of course. And the lifestyle definitely helped me. And like, without wasting time, let us now just
Let
start
me
physical
ask you a
activity.
question. Dr.
on a
Palak,
daily
to interrupt
basis.
you. My God, that was an awesome story you shared. It was in such a small time, but I can just imagine. Even I was in the same place 10 years back. It was just recently we started this journey of physical activity and all that, you know. How did it happen for you? So when you were so bedbound and everything, and how did you start? What gave you the motivation for physical activity? How come?
Yeah. I took challenges as as an opportunity. This is first thing what I did, and the great support from my family members, because initially, if you ask me what challenges I had and what I had and something, but actually I had brain fog, so I was not in the sense to actually experience the pain what I was facing. So the real pain was to my family members, and starting daily and consistently practicing physical activity is the key, I would say. Not only physical activity, of course, all the lifestyle parameters are important, the diet and stress and sleep and everything. But physical activity is,
But Palak, you were telling me you were bedbound. So how did you start? What therapy did you, what physical activity did you start at all?
yeah, for
Initially, I'm
start,
wondering.
yeah. Um, because of the loss of sensations, which actually recovered back very soon after, the grams of steroid entered. But I started with very slow but consistent movements. Um, like moving from one room to other was running a marathon to me initially, but I didn't stop. That is what I felt to help me. I didn't stop.
So what were your other limitations? You must have obviously faced a lot of barriers. I can see that suddenly facing so much of a challenge. Just
Yeah,
walking to a room is a marathon. That's a big thing.
MS is known for sensations. You will get magical sensations. I would really say magical, because these are the sensations above sixth sense. Above sixth sense, these sensations are, and it's amazing. It's an amazing journey. So as I said, I do not didn't take as challenge, but take as an opportunity. I um, just started practicing, just started doing. That is one thing we all must do, rather than thinking about our diseases, about our barriers, about our limitations. Just take one step. This is what helps us. Yeah.
Mm. So, with all these constraints, you said time, energy, willpower. Where did you get the willpower from? The confidence, skills, resources. I'm assuming you got some resources, okay, but wow, how did you develop your skills? What kept up your confidence, willpower? It's a huge thing, right?
When you see your recovery every day, if you see your recovery, if your eyes are open to see the gratitude, what positive things you are getting every day, that is the greatest motivation. And of course, each and every person, and also each and everything, uh, the book written by Louise Hay, and my doctor, my autoimmune doctor, my psychologist, and my family members, especially my husband, everything, everyone motivated me.
Awesome. Awesome. So yeah, I get it. It's not just a personal journey. It's so many people, so much contribution from
I
everybody
would
that
say
helped you
you
too,
should
right?
be empty first to receive. So,
Okay.
yeah.
Okay. Okay. So to receive also requires us, we should be willing to receive. Help may be available, but yeah, unless we are open to it, how come? So, what would you sort of advise to women here, for everybody? You said
Professional
it's not
challenges are the ones women are facing. Like, even if we have a good amount of activity or good volume of activity we have done in the morning for 30-45 minutes, but the whole day, 6 hours, 8 hours, or 10 hours, whatever our practice is almost sedentary. That is what needs to be changed. So think out of the box, and these are the designs actually nowadays a lot of doctors are also using. So first thing is a standing desk in an OPD, so that you are not sitting all the time and you are standing and seeing a patient or writing whatever. This helps. The second thing is using two cabins in while you are in OPD. So completing one patient and then shifting to cabin two, and then alternating. Like, so you will have an opportunity to move after completing each patient. So it will keep change. It will do change in your energy. And the third thing is keep availability of tools around you, so that even a minute you can have during your hospital times, you can do something. Just have some weight instruments, or like stationary cycle, or whatever you can, your a mat, or if nothing can be done, then at least you can do a plank, or you can have jumping jacks, or you can do squats or anything. So this is called flash of exercise during your day, maybe every 2-3 hours or something in the midst of your sedentary timings. This also helps. It has research background to show that it has a positive result. So
Got that.
just
Sitting
take
disease, yeah, it's a new disease. Yeah, smoking kills. I think sitting kills more. Yeah, that's what data show now. Thank you so much, Palak. That was really insightful. But yes, I think quite a few people are already now changing their, OPD styles of practice. Now, what would be your takeaway for all of us to take? What's that one key message that you would give from with your journey for women
okay.
who might face similar challenges?
Yeah, can you check
Okay, yeah,
the last slide?
yeah,
Yeah,
yeah.
okay. So this is my funda. So we are talking about, say, we have learned this x and y axis during our childhood times in mathematics. So imagine positive disease on x-axis, and on the negative side, it is absence of disease. And on y-axis, it is health, positive health. And on negative side of y is negative health. So even if at the present moment, I may or may not be on the positive side of disease. Like, I may or may not be having a disease. I may be having BP, or I may be having back issue or neck issue or anything. But still, I can be on positive side of health, because it is completely different. Health is different than disease. So don't, being doctors, we always think about disease and investigations and this and that and blah blah whatever, but the health is quite away from the disease axis. So it is just 90-degree upright. So change your axis and you are on the health
Awesome. Awesome. So the point is the focus is not
focus.
disease and
Yeah.
how do I treat it, rather than how do I improve my health and how healthy can I get?
And who WHO says that absence of disease is not health. Okay, so it's in definition.
Right. Absolutely. Thank you for bringing that up. Yeah, Palak. Thank you so much for being with us, Palak. It was awesome. Please do stay till the end. And I will come back to you later on all that. Thank you. So on to the next speaker. 1 minute. So let's now welcome Dr. Anjali Agarwal. She is an international speaker, an award-winning health professional, and a strong women's health advocate based here in Hyderabad. She is a consultant physiotherapist, lifestyle consultant too there, with expertise in women's health. And she's done a lot of work in long COVID. She's treated a lot of kids with Ehlers-Danlos syndrome, hypermobility. She has also developed some advanced physiotherapy practices and practices them. She's been trained in UK, worked in UK, in Kolkata, and right now in Hyderabad. I think the list goes on, and I just cut short her so as to fit the slide. But sorry about that, Anjali, but there's too much to talk. So anyway, so let me welcome you on board here. Thank you for being here with us.
Thank you, Dr. Pallavi, and thank you, Pats, for having me here. A wonderful session going on. Thank you, Dr. Palak and Dr. Pooja. It was very informative session from both of you. Yes, Dr. Pallavi. So glad to be here with you.
Yeah, so hi Anjali. So I would leave it to you. I will stop sharing, and since she has come up with a beautiful presentation with women in different age groups and how to address that, I will leave it to you, Anjali, to start your presentation and go ahead. Okay, I'm stopping sharing.
Yeah.
Yeah.
So I can do F5.
Yeah.
Right. So good afternoon, good morning, good evening to all of you. I have come up with a very important discussion for women's health and pelvic floor and fitness. We've heard from Pooja, Dr. Palak about fitness. Let's understand what I will have in place for pelvic floor and how women can utilize exercises without injuring their pelvic floor while they imbibe on the journey of fitness. So that's myself, and we will go ahead with our session. So that's a brief introduction Dr. Pallavi has already given, and I am a brand ambassador for Physical Literacy Days for Pulile Gopijan. So the reason I put the picture in is we doctors tend to talk about health, but we ourselves are not focused towards our own fitness. So this is a message to all of us that we need that time so that we can move. We need two OPD rooms, which I generally do, moving from one room to the another, and I keep walking. I don't sit for long. I tend to stand, I move, I do squats in between my patients, and that is what is my workout throughout the day. So let's move on deep into what's the women health picture in general. So we are covering from teens, childhood to pregnancy and to the menopausal women. All forms of physical literacy we'll be looking at. So we see a young teen who's worried about pimples and acne, which comes around the age of 10 to 14, and they're very much worried about weight gain in the teen period. And then we come on to the early pregnancy period to the postpartum period of a woman gaining weight and is not too happy with putting on weight, though she's pregnant and happy with delivering the baby. Now, the last phase, the woman is having hot flashes and is having a lot of mood changes. And she really wants to sit in the refrigerator because that kind of a feeling she gets when she's not able to cope up with the hot flashes and all. So, in general, what we see is, let's visualize. We see the puberty, the hormones, the pimples, the growth spurt, and the change in the body image. Then comes the pregnancy time, the hormones, the emotional and the mental changes, changes in body dynamics, the weight of the baby puts your spine in a position of lordosis. So the whole center of gravity of your spine changes. Then comes the postpartum phase, which is a blur. The woman is mentally, physically, emotionally taxed and exhausted. And she may have had a lot of birth traumas with the way of delivery she would have had. So the labor pain, which would have not been addressed properly, would have left her with some kind of birth traumas, which we need to visualize too. And the menopausal, we say the cranky period or less to blame on hormones. Everyone talks about getting the women, either she's been talked about hormones or she's been talked about, okay, there's a phase where she has fibroids, let's talk about surgery. So let's look at all these in a very holistic way, what we can do as looking after the pelvic floor of a woman. Now, this is a vicious cycle which we see in the teens phase. Sitting is the new smoking, and all of the young children nowadays are turning into an obese women. And that is why we need to start working on the young girls to prevent PCOD in the teen phase. So you see, a small child has been given phone gadgets, sitting all day, food is being brought on the table, the child is having very less physical activity. The girl is being told you got to study and secure good future and keep studying all throughout the day. And that is what is leading into our present generation, which is very obese. And this women ends up with PCOD, and then we see with adult obese child or a woman with infertility issue when she tries to conceive. So we need to be looking at PCOS in general from a scratch. What we put in the early years, 1 to 10 years of life of this young girl, is what we need to look at after 10 to 16 years so that PCOD things are not being brought into the picture. And now we see the posture of a man. We started up a Homo sapien and we've ended up sitting like them. But the Homo sapien was an active animal. He was climbing trees, jumping around, moving throughout the day, eating fresh fruits and vegetables. But what is a modern day person doing? We are just glued to a screen and sitting on a chair. And our lifestyle has become too sedentary. So let's evaluate what has happened to the posture of a man or a woman or a woman. Now, these are the symptoms we see a young girl coming to a clinic with obesity, acne, periods not coming in time, has mood swings, constantly tired and fatigued, and is going into insulin resistance. So, what is the pitfall here? The pitfall is sedentary lifestyle being given to the child from the very beginning. So, that's where our role comes in teaching the young parents of how they should imbibe more physical activity for their young girls, not to be shy of going to a sports class, not to be shy of going and doing some physical activity. That's very, very important. So, and a common thing which we see in these young girls is painful period or a bad period. They talk about period pains at early age, and we always tell it's common thing. Let's just ignore it. No, we have an issue which is called as endometriosis, which is showing quite commonly now in these young girls. Painful period, very heavy clampy menstrual bleeding, spotting in between the periods. And there's also a rapid heart rate which young girls between 12 to 14, which I come across, are facing. So let's not just send them away thinking it's a natural part of the period. Let's understand what is causing it. What are the simple exercises they can do is the Chakki Asana. The olden days, our grandmothers would sit on the floor and they would have to rotate and, ground the floor or have all their masalas or spices grounded with their hands. That was enough physical activities. Why didn't we see PCOD, endometriosis in the olden age? Why we are seeing now more often? Less activity, less sitting on the floor, no exercises for the glutes, no exercises for the pelvic floor. So this step 1, step 2, step 3, the lady moves forward, moves sideways and move backwards. It's a full movement of the pelvic organ and the pelvic pole, which helps to stimulate your ovaries, helps to imbibe more blood flow into your pelvic floor. A very important exercises all women of all ages can do, and especially the young girls should definitely do it, because nowadays what we find, the young girls can't even sit on the floor. Forget about squatting, they can't go on the floor and sit into a padmasana. That is the biggest cause of PCOD, also one of the reasons which I'm seeing in many of these young girls. Now let's come on to the pregnancy time. Now, what is the pregnancy period? How much of aerobic or resistant exercise a young pregnant women could do? We can prescribe about 15 minutes 3 times a week to working up to 30 minutes to 4 times a week. But it all depends upon when they seek our consultation, if they're having pelvic pain, they're having PID, or they're having some kind of pubic symphysis. So exercises are tailored to their kind of environment they are living in, also tailored to their conditions of the body. Now, we can give them moderate intensity with perceived exertion rate of 12 to 14 breaths, resistance and flexibility training with aerobic training combinations, which can be yoga, not doing instant stretching exercises because they're already having flexible joint because of too much of relaxin hormone, and many of them may have body pains or a lot of pelvic pains because of the changing spine. So we can recommend a very basic exercises to walk till you find with uttering a word or a sentence. If they're feeling out of breath, that's the limit of exercise they should be able to work out so that they will have a good baby. Let's focus not on the mother. Let's focus on the having a baby who will be healthy, not being obese. So the mothers who keep sitting will again give rise to a PCOD girl or a man or a boy, like that, you know? That's the issue which we are seeing here. So we can incorporate several positions of exercises which are safe for pregnancy, keeping in mind not to do the headstand, which nowadays a lot of yogic postures are, trying to facilitate, because it can cause you hypotension and, kind of doing Surya Namaskars. You need to understand there should be no postural hypotension. So safe exercises, which can be low impact, like walking, swimming, stationary cycle, yoga, can be modified according to the patient's criteria. And many of them also wants to do sports. They can do simple badminton, if at all, as prescribed by their gynecologist or the pelvic health physiotherapist. They should avoid doing exercises in heated atmosphere, not to sweat a lot, and drink plenty of water during the exercise session to prevent early onset urinary tract infections also. And they can avoid contact sports like soccer, basketball, because there can be risk of falls and there can be risk of injuries as well. All the yogic postures should be monitored properly with the pelvic health physio so that we are not trying to overstress their SI joint, which is called the sacroiliac joint. We get very pulled out. These sacroiliac ligament expand during pregnancy. So any kind of wrong movements can cause them lot of SPD or pelvic organ prolapse and all. So we need to be very careful and watchful and advise them, not a fearful advice, but a advice of care. And a simple exercise like core pilates, this lady is doing core pilates at around the 34th week. So we don't tell them not to do these Pilates because this helps to build the core strength. The abdominal muscles get stronger, and the birthing process, the labor process is easier. The child born is healthy weight, and the women is of a healthy emotional, when they exercise, they release good hormones. So they're very happy and they have a very, very good birth. Now we come to the postpartum phase. How many of you would have understood the word called mummy tummy? You see a tummy which is bulging of your patients. They deliver the baby and the tummy looks big. And the mother comes, I've not lost weight. I have a big tummy. I want to look like Aishwarya Rai in a month's time. But is it possible? No, it's not. It's not a logical way to tell them that. But what we see in these women with bulgy tummy is just not, the aesthetic level of it, but we see a lot of incontinence. They have tailbone pain. They have diastasis recti. So the linea alba, which separates the muscle of the rectus abdominis, gets overstretched during the pregnancy time, which is a natural phenomenon. But many of these women do not return back. The linea alba doesn't return back after the 3 months or the 6 months. Then they need specialized pelvic floor care with us, and we help them to get this back, and they can actually help themselves to not have these issues. So the common issues which we'll see is urinary dysfunction, incontinence, not able to poop, not able to, go to pee easily, or they're going too much often. They want to pee, and then they're having painful, in urgency of urine and an obstruction outlet deviation. So these are the common issues which I treat for a lot of these postpartum mothers. And that's why we talk about how do we address exercises for these women? How do we address fitness for these women? Because they have these issues going on. So let's have a safe call. So We also see the separation of the tummy. So we see the pelvic floor, the bladder, bowel, and the sexual functions will all combine together for these women postpartum.
We have 5 more minutes. I
Right,
think
right. We're just going through. Yeah. And then we see all of them show up as abdominal bulge, back pain, poor posture, core laxity, and incontinence and prolapse. So, what are the key reasons we see is obesity? So, we need to make sure that during pregnancy they are keeping their weight optimum. Pregnancy, childbirth, lifting heavy weights can cause it. So, after childbirth, we need to advise the women how to lift their babies. So, as pediatricians, the message is how to feed your baby is very important. The posture of feeding the baby is important so that they don't get into the diastasis recti condition. And definitely, genetic disorders are one of the reasons why a lot of women will have very loose core muscles. So the things which we should always advise the women is not to do sit-ups, not to do planks or push-ups or quadruped positions, both legs raised together or twisting movements after their delivery or even pre-pregnancy to many of these women because they can stretch over the linea alba and that can lead into herniation also. The umbilical hernia or the inguinal hernia becomes very much common in many of these women. So these are the safety precautions which all women on doctors should advise their patients. And pelvic floor incontinence is the biggest reason why we see a lot of women come to us that they're not able to feed the baby because they're having incontinence and they're not having good emotional level of life because of these issues. So the key takeaways can be that diastasis recti, pelvic floor disorders can be together. So the holistic approach should be core and pelvic floor strengthening under the guidance of a pelvic floor physio because we understand what kind of core and what kind of pelvic floor exercise the individual needs because everybody's core and pelvics are different. Some have very tight pelvic, some have very loose pelvic. So exercise are modified and tailor-made according to their condition. So simple exercises, pelvic floor for women of all age groups, all pregnant, postpartum, menopausal can do a simple cat and camel, sitting on a ball and tightening of the abdominal muscles, doing a trikonasana in yoga, we say it's a very good exercise to lengthen your quadratus lumborum to prevent back pain. Lying down on a foam roller is a very good exercise again to open up the chest wall because a lot of women after breastfeeding tend to droop their shoulders down. They end up with neck pain and back pain. They tend to have breathing discomfort. So all these basic exercises can help a women to have a strong core, have a strong pelvic floor, and can also prevent them from having any kind of neck pain and back pains and incontinence also. So an active pregnant women will have a very good pelvic floor. That's what a message should be given to all the women actually. And we see these common symptoms of safe exercises, Kegels. We always say you need to tighten the pelvic floor muscles. But how do we tighten it? Whether we should tighten, whether we should not tighten. So a lot of women nowadays are sedentary. They keep sitting. They by default will have a very tight pelvic floor. So if we ask them to squeeze the pelvic floor, it's going to go more tight and will cause problems of prolapse and incontinence. More will increase and cause UTI. It will call backflow of the urine into the ureter. So that's important that we should advise the women that they're doing Kegels only when they have very loose pelvic floor, not very tight pelvic floor. People should be doing these exercises. So you see this exercise when they're doing, it's very important how to teach them the exercise. See, the rib cage is all jetting forward, but the other exercise where I made a tick mark is flattened. So we are doing a lot of exercise, but if a woman postpartum menopausal woman is having a rib flare, she'll always end up putting a lot of pressure on the pelvic floor, will cause organ prolapse like cystocele, rectocele. And a lot of women nowadays will talk about, I did a high intensity workout, I'm ended up with incontinence, I'm having back pain, I'm having tailbone pain. So how do I do it? We have to remember rib cage is our first foundation, and second is our pelvic floor. We always have to optimize these postures for these patients. So menopausal health is again, we see a lot of issues for menopausal women, they have very loose joints and laxity of the joints increases because of depleting estrogen, and they have mood swings, so they feel very, very emotionally recharged also sometimes. And we know the blood vessels become very thin and fragile as lack of estrogen. And many of these women will have high blood pressure. They show up at the emergency with very, very fluctuating BPs. So we need to monitor these women and tell them to exercise very, very diligently and softly, not to do very high intense crash diets and high intensity workout, as Dr. Pooja has already mentioned, but to optimize your cortisol level and exercise in a very safe zone so that they can get their cortisol in a well proportionate levels. So simple exercises, I always tell them to do simple yoga combined with pelvic floor strengthening. Swimming, again, focusing on relaxing the pelvic, tightening the pelvic. Strengthening exercise should be focused with pelvic floor. So when you're lifting weights, always remember your pelvic floor shouldn't be too tightened, neither too loose. Focus on the abdominal muscles, focus on the pelvic floor, draw in them, and then lift the weight. That way, you are optimizing your fitness while preventing the exercises which are not causing damage to your pelvic floor. Join a group class. That's a very best way to, to get more on endomorphins from all your positive buddies, and adding more, talking helps you release all your stress hormones. So pelvic floor, again, I've talked about earlier, it's a hammock. Okay, so this hammock should bounce back and forth. It shouldn't be that it should just descend down. It should not be too tight, it pushes up back. So it plays a very important role. It is your foundation which makes you stand and walk and run. So important part of pelvic floor disorders, as I'd already said, if we are not looking at proper way to exercise, we'll always have women with incontinence and urinary tract infections. We need to prevent by hydrating well, letting to evacuate better. During exercise, please make sure using the washroom many times. And as doctors, we don't get time in between our patients. We don't take a bio break. Please take bio breaks. Never please hold on to your bio break moments for your patients, because then we end up being unhealthy. So treatment strategy is always early rehab, home care, give exercises to women so that they can be active at their home, early rehab, through ergonomic setups, core awareness talks, movement breaks, and always screen your postpartum mother. As doctors, as pediatricians, talk to your mothers. How are you doing? Do you feel any pain in the tailbone? Do you feel incontinent? Refer them to a pelvic floor physio so we can make their lives better. And any questions, we are always, I can't guarantee you any answers, but questions definitely you can ask me. Thank you, everyone.
Thank you so much, Dr. Anjali. That was so comprehensive. You covered it all. So,
Yeah.
and I'm sure there will be a lot of questions, and I think we will keep it to the end because we have other speakers coming in. Please do stay on. And yeah, everybody keep your questions. I know you'll have a lot more for Anjali. She's really covered everything, but yeah, more. So let's now go on to our next speaker. I'm inviting Dr. Nilima, our special guest. Just give me a moment. Yes. Yes, is it full screen for you?
Yes, ma'am.
Yes. So on to Dr. Nilima. Let me welcome Dr. Nilima. She is a consultant neonatologist at Rainbow Children's Hospital, Hyderabad. I think I will leave it to Dr. Nilima to talk more about her. It's really it was very inspiring for me to listen from her. So I would like you all to listen from her too. So on to you, Dr. Nilima, please tell us more about what was your journey, your fitness journey all about.
Thank you very much, Pallavi madam. Am I audible, ma'am?
Yes, yes.
Okay. So at the outset, I would like to thank Team PATS for giving me this opportunity. And special thanks to Pallavi madam for encouraging me to share my story in this wonderful forum. So can I start sharing my slides, ma'am?
Oh yeah, sure you can. And then I will stop sharing. You can go ahead. Right. Please do.
Is it visible, ma'am?
No, not yet.
Now, ma'am, can you see?
No, I cannot. Can you see? Can others see? I'm not able to see.
Yes, ma'am.
Okay. So fine, it's visible for others. You go ahead, Nilima.
Okay. So I would like to, over the next few slides, I will be talking briefly about my medical history, my daily struggles, my passion for distance running, and the most cherished race of my running career, why I continue to do what I do in spite of having all these issues, and what works for me. So I wouldn't take much of your time. I am a neonatologist by profession. I work for Rainbow Children's Hospital, or rather I was a neonatologist. I don't know, I no longer practice neonatology. I'm a wife, a mother, and a daughter. I'm an avid reader, a travel enthusiast, and a distance runner or walker. I've been running for almost 15 years now and have almost more than 25 half marathons under my belt. So a brief medical background, which changed my identity to a patient with a chronic illness. So I survived a subarachnoid hemorrhage.
No. Dr. Pallavi.
Yeah, Dr. Nilima, we're not able to hear you.
Yeah.
Hello? Hello, Dr. Nilima? I think there must be some network issue there. Let's just give it a moment.
Call her.
Yeah, the Wi-Fi off, Anta. She's
Hello?
connecting back in a
Madam.
moment. She'll be connecting back in a moment. But in the meantime, let's go on to our next speaker. We'll come back to Nilima and listen to her story, definitely. So let me now welcome Dr. Nishita Jasti. Please focus on her. While I share, just give me a moment. No, this is not it. So Dr. Nishita, Lakshmi Nishita Jasti is a gold medalist and is a bachelor's in naturopathy and yogic sciences. She is a scientist at the Department of Integrative Medicine in Nimhans. So please welcome Dr. Nishita.
Hello, very good afternoon to everyone.
Yeah.
It was wonderful listening to all the speakers, and I really thank PATS and Dr. Pallavi for this invitation and this very session. So,
So not only is she a scientist, she's a master's in yoga therapy, done multiple things. I've just mentioned a few here, not everything. Acupuncture, PhD in integrative medicine. She's also an author. She's written some chapters in books. She's also a research scholar right now doing some projects too. We will hear more from her about that. But let me first ask Dr. Nishita. So she is a yoga therapist and she's already working with the pediatrics team in Bangalore. I've heard from her recently. So that really amazed me, though I knew her, I didn't know this about this. So now, for women who are new to exercise, Dr. Nishita, with no levels, nothing, and all that, and we are busy professionals, everything. But we cannot give in so much to the gym and all of that. So So you are somebody who has taught yoga. So what sort of a perspective can you bring for us in this? Can you share? I mean, would you like to share? Do your sharing? Do you have slides?
Yes, yes.
Okay,
I
I
will
will
share
stop
my.
sharing here. You can go ahead with your share.
Okay. Can I be made the co-host?
Are you not? Okay. So Dr. Pavan, Satish, can you just make a
Yeah,
co-host?
it's
Yeah,
done.
yeah,
Yeah.
right.
Thank you. Are my slides visible?
Yes, ma'am.
Yes, yes. Go ahead.
Yes. Yeah, so the focus of my presentation, will be like yoga as a reset button for everyone, in particular to women. Okay, so what Dr. Pallavi just asked. So just getting before that, getting there, I'll just give a small background from where this, how the presentation will evolve. So basically, it's for everybody, and in particular women, because they're multitasking so many responsibilities and roles on daily basis. So we just continuously, there is a phase of stimulation or stressing up, and then there is no respite. Okay, we're not able to come to our baseline. Okay, so this is how the daily life of a woman look, as if she's um, juggling between a lot of responsibilities and roles to play. So in this, what happens is naturally there is a tendency to ignore herself and not being able to take time out of her schedule exclusively for some, gym activity or some outdoor activity. So yoga is something that, you can do it at your own convenience and at your own place. And so now we'll see what actually yoga is. Okay, so you can see the contrast of the two images. Okay, so the upper image is basically Guruji BK's Iyengar ji, who's doing an advanced yoga posture. And the second image is a drunkard who's exactly almost in the same pose, like a bridge. Okay, maintaining the posture throughout the night, just drunk. Okay, so what is the contrasting feature between these two pictures? So this is where actually the role of our mind plays, or the intention, or actually the focus, where your awareness is. The awareness and the mental aspect is what differentiates, a regular posture to a yoga posture. Okay, so the very definition of yoga, it comes from Patanjali Yoga Sutras, which says yoga chitta vritti nirodha. That means yoga is basically termination of the agitations of the mind. Okay, so naturally when you have to tend, when you have 10 things to do at the same time, and you're working at the office, and then you have to plan the meal for the evening. So there are a lot of activity that happens in the mind. Wherever there is a lot of activity, there is always a tendency to have some friction that comes in the mind, which also expresses out as irritation, irritability, anger outbursts, or not being able to rest. There is a lot of fatigue. So this is where I see the role of yoga. It's like a reset button that everybody has to opt, and basically focus inward and get that break. Okay, so these, I will not go into the details of the 8 limbs, but these are the 8 limbs of yoga, which Sage Patanjali describes. So, which has it starts with the code of conduct on how you should how you should basically be with yourself or with the entire society. So individual and social level of conduct. Then comes the asana, then pranayama, which is breath control and regulation of breath. Then pratyahara, with again which helps you to basically internalize your senses and prepare yourself for meditative techniques. Okay, so the meditative techniques are dharana, dhyana, and samadhi. So now we will try to explore, is there really a connection between body, our breath, and our mind? Okay, so you know, many of the times, so yoga is something, it's just not it is I mean, sadly just identified as some practice, which is either asana or pranayama or meditation. But from my experience and from the even the ancient traditional texts, this is yoga is beyond the practice that happens on the mat. So how you deal with your situations, all of this matter. So this is also something that trains your body, your how you handle your breath, and this in turn basically trains on how you can handle your emotions and your thoughts. Okay, so we will just try to explore this connection through an example. Usually, when a person feels sad, what is the posture that they adopt? Is this something like this is the common, posture a person who is sad adopts, right? So your body is completely closing down. So something that happens in your mind is bringing an influence on your body. Is it right? So, what we're trying to do in yoga therapy is we're trying to do certain postures in your body, at the level of your body, and regulating your breath in a certain way to bring the effect on your mind. Okay, so people who are sad and depressed, we usually prescribe asanas which are more chest opening, back bending. Okay, so that helps them feel better over the course of practice. And usually people who feel happy, what is when you go to a beautiful scenery spot where you're seeing a sunrise or there is a cool breeze that is coming and touching you, when you're happy, how do you open yourself? So this is how you basically are at your body. So something at your mind is reflecting, or it shows on your body. So in yoga we're trying to do just the reverse, using the same path. The same thing when we are trying to explore the connection between the breath and the emotion. So you see that when you're sad, your breath is long, and it is you take a sigh, oof, as if you're tired. But when you're angry, you kind of hyperventilate, and then when you're happy, it is in a certain way. So your emotion has an influence on your breath, right? So we're using the same link to basically train your breath in a certain way so that you can feel the emotion, or you can train your mind to be at a more balanced state or within your control. Okay, so this is the connection, this very connection between the body, breath, and mind comes from a very ancient reference, which is Taittiriya Upanishad, where the entire course of the manifestation of disease, the very manifestation of the disease, it describes that it basically stems out from the manomaya kosha, which is the layer of your mind. Okay, so this is the 5 layers of existence, where the very superficial layer that is visible to us is the Annamaya kosha, or the physical layer, the subtler to it is pranamaya kosha, which where your life force basically functions and manifests. And much subtler to that is your mind. And even subtler to that is your intellect, buddhi. And very, very subtler is the layer of bliss, or a natural state of being in the state of happiness. So, right now, because of our daily challenges and stress, what happens is there is a lot of conflicts that happen at the layer of your mental layer, that is your mind, the manomaya kosha, which becomes so turbulent that it, kind of acts like a thick cloud to access your Anandamaya Kosha, that is the layer of bliss, and also to have a stern intellect. Okay, so that is what makes us choose wrong lifestyles. Though there is something that is, restraining us from actually acting it out. Yes, so that not being able to take action, even though that comes from this turbulent layer of the Manomaya Kosha, which then percolates down into irregular patterns of prana. Okay, so that it could, kind of manifest as abnormal sensations in the body, irregular digestion, sometimes as hyperacidity or indigestion, or any function that is getting altered, or some pain in certain areas or numbness in certain areas. And then physically, it manifests as a full blown disease or a disorder. Okay, so beyond just the physical level of fitness, as also WHO emphasizes, the mental and the social level and also the spiritual level of well-being is very, very important, especially for a woman who is juggling between so many roles, and to be at peace with herself and with everybody who is around in the family. Okay, so yoga basically it leads to calmness, improved mindfulness, compassion, sense of connectedness. So these are the four components that I am talking about, that we need to practice beyond the mat in your day-to-day activities, that naturally brings in the component of enhanced mental health and emotional resilience. So these are the practices that, so here I come to Dr. Pallavi's question, that is there something simple enough that somebody at least can do these practices, and they're able to you know put it into the routine. Okay, so this is a very, very, very simple module that helps women through all the ages. Okay, so and this is something that you can always do at your own clinic, by taking maybe a 10-minute break in the first half, 10-minute break in the second half, and just do it on your chair. If you don't get something that something like a yoga mat, if you don't have such facility, even on your chair you can manage to do these practices. So the first one is called as Tadasana. Okay, so this is a very simple practice where you need to basically separate your legs in a way that they're just in the line with your shoulders, and your feet pointing forward, and then you interlock your fingers, and then you just stretch your entire body up, stretch up completely, and let your entire spine lengthen. Okay, and you need to feel that entire stretch in your back. Okay, and then this you can do it both standing as well as sitting. Okay, if you don't have enough space, you can do it sitting, or you can stand and do it. Completely stretch, 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 and then go to the right. So when you go to the right, make sure you do not bend forward or backward, just to the right. Stay there for 5 breaths. So the most important thing that you need to remember is you do not hold your breath. You breathe comfortably, and as you breathe, you get more comfortable in the posture. Okay, so 5 breaths you maintain on one side, then you breathe in, come back to the center, and then again, give a nice stretch up, and then go to the left side. Okay, and when you go there, again, try not to force yourself, just be comfortable, allow your breath to settle down, and take 5 breaths. Center. Okay, so more than the count your breaths. Okay, the breath which you're in, you're comfortable in. And the next posture is Ardha Chakrasana. Okay, so Ardha Chakrasana is basically you place your hands at your back and make sure your elbows are closer to each other. Okay, and then also make sure that your feet are parallel to each other. Now you breathe in, and as you breathe out, just bend back. Try to feel the openness in your chest, your shoulders rolled back, and try to get comfortable again at your breath. Okay, and then just maintain it for 5 comfortable breaths, and then come to the center. Okay, and the other one, very important practice that can be practiced in all the age groups of women is the cat and cow. Okay, so this is cat and cow, where you first, am I visible? Yeah. So your spine is first straight and your legs are parallel to each other. Now as you breathe in, you hunch your back down and look up. Okay, and as you breathe out, you hunch your back up and bring your chin to the chest. Breathe in and breathe out.
Hello,
Spine
Dr.
is,
Nikita. It's very nice, but I think we really overshot our time here. Some of our people might want to leave.
okay.
Can you by any chance be in the WhatsApp group and sort of help us later on? Like, I mean, sort of. I know that you're already running a program in Bangalore, no, with the pediatrics group there. Is there
Yes.
something you can offer to all of us? Maybe because we're running short of time, and I think this itself is so big. It's such a big session right now, but yeah.
Yeah. So yes. So yeah. So we actually run a morning batch at 6:30 a.m. Just a second. Get into it. Yeah. So this is something that anybody can join. We do brief sessions for adolescents who are referred to us once in a year from the Indian Association of Pediatrics, the Bangalore chapter, around the Adolescent Week, International Adolescent Week every year. Apart from that, these are the sessions that are open to everybody, all the general public, to join from 6:30 a.m. to 7:30 a.m. It's a Zoom meeting. So this happens on every day, Monday to Friday, except for the government holidays.
So anybody can ask questions or join and just do the session and go. Are we allowed to interact?
So this is basically a practice session. On Tuesdays, there will be a brief session where there is interactive session after the practice module. So there you can put up your questions. And also this is my email address. So if there are any queries or anything that you want to know further, you can always mail me on this ID. So these are the services that we provide here at the department. So we have clinical yoga therapy, Ayurveda, and acupuncture for specifically mental health. for from adolescents and adults both, and we also run certain certificate courses for people for mental health professionals to know about in details of yoga, and also we have masters in yoga therapy and postdoctoral and doctoral courses as well that we offer.
Awesome. Do you have any short courses of to teach yoga online for people like us, for women or anything like that? Any or anything in the pipeline?
So it's basically on a request basis, because we've seen that if it goes very long, usually people don't take up. So if there is any request from any institute, we usually take up such requests.
That's really nice to hear. So would you mind if I put your name, and can you join the WhatsApp group of all our pediatricians here? And maybe people can ask questions and we'll see where it goes. And if they're really interested in this, you can take it up.
Sure, yes.
Oh, that's awesome. Thank you on behalf of all our pediatricians. In the interest of time, I'm really, I couldn't,
Yes,
I mean,
yes, I
sorry
understand. We're
for
already
everybody
short of
because,
time.
yeah, but thank you so much.
Thank you.
Yeah. So, thank you, Nishita, for sharing. I think if you can stop sharing,
Yeah.
So, again, now let me just go back to our guest, Dr. Neelima, to hear her story. Neelima, you can start sharing.
Is it visible, ma'am?
Not yet. Yeah, now yes.
Yeah. Okay. Sorry about the glitch earlier. So this is I will take only 8 minutes from now. I understand the time crunch. This is my brief medical background, and this medical background has changed my identity to a patient with chronic illness. I survived a subarachnoid hemorrhage in 2019, and I had a brachial plexopathy and left upper limb weakness at that point of time. And then
Dr.
later on, my
Neelima, you can go a little slow. You're running. It's okay. We have.
Okay, ma'am. Okay.
Yeah, we would
So
love to
my
hear how you're
bronchial
learning.
asthma started worsening from 2020. These two are now nowhere related to each other, but my lung function came down to an FE1 of 37% with no reversibility. That means levosalbutamol was giving no response to me at that point of time. And then I had to undergo bronchial thermoplasty in 3 stages in 2022, followed by biologicals for about 2 years, which also didn't give any response to me. And then 2023 June onwards, I had been on single inhaler triple therapy with Trelegy Ellipta. And later on, because of lack of response to any of these modalities, I was recruited into a drug trial, which is called Hercules trial, conducted by Sanofi since October 2024. The drug is called Linsecamig, and it's an anti-thymic stromal lymphopoietin plus anti-IL-13 bispecific monoclonal antibody. Phase 2B initially, then followed by phase 3. Phase 2B, unfortunately, I got a placebo. Now, phase 3, I actually got the drug and have been relatively stable since November 2025. Apart from this, most of our speakers have spoken about perimenopausal problems, and I have a unique problem, perimenopausal migraines. So, out of all these morbidities, asthma is the beast. It is the proverbial elephant on my chest. As you can see on the Strava fitness chart, my fitness has come down by more than 60% from October 2021 onwards. And my peak flows have always been in the red zone. My energy levels have been low. In other words, it is like waking up every day and realizing there is no weekend. Since then, since 2020, 2021, I have been wheezing 24/7, the non-stop wheezing. I have unpredictable ups and downs. Sleep is interrupted and there is constant fatigue. My exacerbations are frequent. My phenotype is a frequent exacerbator phenotype. So I have almost 12 to 15 exacerbations per year, out of which 3 or 4 require oral corticosteroids. I gained weight because of the steroids and inactivity with consequent bendopnea. There are days when retrieving vegetables from the refrigerator is difficult because I can't bend down and take out the vegetables from the fridge. It impacted my work. I had to stop the ICU work, and I'm confined to outpatient department where I don't have to move much. It affected my household chores and responsibilities. And there are days when walking has become difficult, forget about running. The psychological burden, the frustration, loss of confidence. I no longer go out alone or travel alone anywhere. I need somebody with me because I don't know which day is a bad one. Of course, there are good days, definitely, but the good days often lead to woman bus cycles. We tend to, anybody with a chronic illness will definitely understand what a woman bus cycle is. You tend to overdo on days which are good and then which contributes to more bad days. Of course, throughout all this, I continued an exercise routine. I will not say that I stopped my exercise routine. I have been active throughout, but mostly walking and yoga. And there came a moment of realization. I had to do something. I could not go on like this. The emotional impact on the family was too much to ignore. And I had to put a full stop for the pity party I was having. This is a chronic illness. I had to accept that it is going to be there lifelong. The suffering is going to be there, but I cannot go on having pity party for myself and feeling sad for myself. And I had to regain some control, some independence, and some loss of confidence I had to regain. And of course, weight management also became important more for lung function and than for body image. As you can see in the prescriptions, weight reduction started becoming part of the prescription. In other words, I had to find a purpose beyond my illness and concentrate on what I can still do, not what I cannot do. Progress over perfection was the goal. So I started introducing short run intervals into my walking routine. This is called a Jeff Galloway method. It is nowhere near what I once ran, but it gave me the joy of movement. And I started intermittent fasting. I know this is a controversial topic, so I'm not going to go into details about the intermittent fasting. I also started an anti-inflammatory diet, which is vegan, gluten-free, and plant-based diet. I continued with yoga, meditation, practicing gratitude for what I can still do. I prioritized my sleep. I targeting at least 7 hours of sleep, even though it means I have to try for 9 hours because of the difficulty in sleeping because of my wheezing, and breathing exercises like pranayama. And I have a daily flexible routine, prioritizing rest. Flexibility and rest are the key here. Flexibility on days when I cannot do, I have to restrict myself. And on the days that I can do, on the good days, I do a little more. Pacing and respecting the disease, honoring the limits of my body are important. And of course, medication adjustment is required for any physical activity. Any physical activity needs pre-medication with salbutamol, and any duration of walking or running more than 2 to 3 kilometers will need more doses during the course. These are the couple of races that I have done over the last 5 years, and every race has either triggered an exacerbation or has happened or worsened an ongoing exacerbation. As you can see, there's a gap in 2022 when I underwent my bronchial thermoplasty, but I slowly resumed back. This will be incomplete without talking about my most cherished race, the Marathon Portos of Paris 2024 Olympics. This was the first public event in the history of Olympic Games on the 10th of August 2024, just before the closing ceremony of Olympic Games. The selection process happened over a period of 4 years based on a series of challenges which I participated, and my selection came in April 2023. Now, of course, I had the selection, but the biggest dilemma was whether I would tolerate the long flight plus the run or not. Because this, at the time, starting from August 1st onwards, I was in an exacerbation and I was on oral steroids and multiple nebulizations per day. So the long flight itself would mean altitude, and it would impact my oxygenation. So I was not sure whether I would tolerate the flight plus the run. It was a perfect recipe for a disaster. So, but still, we decided to go ahead, and the plan was to return home quickly before my lungs realized what I did. Otherwise, we traveled only for 5 days. I mean, who will go to Europe for 5 days? So, but I must say the experience was incredible and unforgettable. I think if I have to do it again and again, I will still do it. That was the only time my heart rate crossed 200, but I will do it again and again if I get the chance. The return, of course, was pure hell. I had to take continuous nebulizations in the flight, and I couldn't walk in Mumbai airport, but it was totally worth, and I have no regrets there. So these are a couple of pictures from Paris. This is the message showing my completion, and this is the message showing my selection. This is my medal. And these are the other, this is from Mumbai, this is from Chennai, this is from Auroville, this is from Hyderabad Marathon, this is from Try and Trek and David's Crow Trial in Meghalaya. But behind all those smiles and medals, there is tons of agony. In this picture, you can see my distress captured by a race photographer. I can't say that I like this picture very much, but I put it so that people understand what running with a chronic illness means.
And I think, let me put in a word, that's her husband next to her.
I will come to him. So there is hours and miles of training and loads of love and kindness from people around me, which is why I'm eternally grateful to my support system, my husband, Dr. Satyaprasad, and my son, Pranit, who bear the brunt of my disease every day. And of course, my parents, siblings, in-laws, and I special mention about my pulmonologist who has been through me, supporting me all through. My colleagues, my seniors, staff, and Rainbow Children's Hospital management, who always have supported whether I came to work, whether I took a sick day off, nobody complained. And they've always supported me with their words or actions. And my friends. My why on why I do this in spite of suffering so much. Running or walking is the double-edged sword for me. It triggers symptoms and has been responsible for many exacerbations, but it is important for pulmonary rehabilitation. And other than that, it also has taught me how to survive difficult days, to take each step at a time, just like the last few kilometers of a race, trusting that there is a finish line, however far it may seem. This quotation I have taken from a book called Can't Hurt Me, written by David Goggins, who is an American marathoner and an ex-Navy SEAL. And he says that however harrowing things are, all bad things will come to an end. And we just have to be patient till that time. Now, for me, what works is consistency. This quotation is also not mine. This quotation is from Des Linden, an American marathoner. But I put it because it just exactly correlates with my feelings and my thoughts. Some days it just flows and I feel like I'm born to do this. Other days it feels like I'm trudging through hell. Every day I make the choice to show up and see what I have got and try to be better. So my advice is keep showing up. So I would like to finish by talking about my run walk streaks and consistency. You may call me crazy. My current streak of running or walking is 609 days and counting. Previous streak was 1224 days and I missed a day because of a severe migraine episode. And that day is the only day in more than 5 years that I missed an exercise activity. Yes, in spite of all the procedures and all, I missed only one day in the last 5 days. Yes, it is very much addictive. You can see my Strava streak weeks are 326 weeks, and my average weekly mileage is 50 kilometers. I would like to finish by saying quotation by Thich Nhat Hanh, the best way to heal is to begin by stopping everything and being totally with the present. And I thank all of you for being here today and listening to me. And I especially would like to thank Dr. Palak for sharing her story here. It is quite inspiring one.
Thank you so much, Dr. Neelima. That was an awesome share. I'm sure everybody here is touched, inspired, and have chills down their spine to see what all you went through. On a personal note, let me tell everybody. So she's my colleague, and we have seen her through this journey. She's always a quiet person. She never talks, and all what she shared today is something even I don't know much about. Okay, so she's always been present and very, very promising neonatologist with Rainbow. She had to stop her career and go back, and it is even for the Rainbow management. I'm sure they feel the loss. That is why they support her so much. And in spite of all of this, she's there for her patients. She comes to clinic. She has a nebulizer with her in her clinic, and she still is there for the clinic. And you will never see her with her wheeze or a tiredness on her face. She will always be smiling and talking to her patients. We also haven't seen her wheezing or in her bad state. Even when she had a subarachnoid hemorrhage, where most people would have given up their career and taken it easy, okay? She had a hemorrhage, life-threatening. We all know this. And she didn't give up. She was back again here in the hospital and still going strong. She's an inspiration for me too. Thank you so much, Dr. Nilima, for accepting the request and being here with us today. Okay.
Thank you
So-
so very much. Sorry, I'm interrupting, but I have goosebumps here. So thank you very, very much. It is so inspiring. Seriously. Hats off.
Yeah. So
Thank you all.
Yeah, Nilima, you can.
Yeah, thank you all for the kind words. Pallavi madam, you are an inspiration for me too. I mean, I'm loads and loads of medication. You are not. So I try to cut down my medication, but I don't think it's working for me.
No, you've done an awesome job, Nilima. Continue doing that. It's not easy. I know it's in no way is it easy. But I think the takeaway for us all here, all women here, it's not like we need to be faced with so many problems and all of that, but just the fact that we can make something out of our own lives. In spite of all the challenges that life throws at us, any normal woman, I mean, a so-called normal woman still faces all the challenges of, the hormones, the childbirth, the changes, physiology, etc. In spite of all of that, there is something that you can make out for your own life, and every story is in itself inspirational. Not just, I mean, Nilima says, I know it's outstanding somewhere there, but then we all have our stories, and I think we need to unfold that. To that, let's start our fitness journey now. And I'm now inviting all of you to start your own prescription for fitness. Now that you've heard all the talk, let me just share what we have here for you. Let us all now start our journey with our goals in mind. So any goal, if it is not measurable, it is not going to be attainable. So let it be specific, let it be measurable, let it be achievable, realistic, and time bound. You know the SMART goal. So then let's start our prescription for this. So any prescription for the physical fitness follows the FITS principle. The frequency, I mean, how often would you like to exercise? So I invite all women here, wherever you are right now, considering all the things, you can start aerobics, you can start strength training, you can start flexibility training, any level of exercise you want to. And it does not have to be exercise. We already know there's something called exercise snacking. You can do it between your in your consultation chambers, between your chores in the house, even incorporating it inside those chores too. The yoga asanas Dr. Nishita was talking about, everything can be done even as you're moving around in your bedroom, in your living room, in the kitchen, everywhere. See, wherever you can include it, start wherever you are. So how often would you like to do that? It can be as often as, okay, let me start with just 2 minutes today. It can be as much as that. And how hard do you want to go? Dr. Anjali also has told you that, you can go as high as I'm getting a little breathless, or I'm not able to complete a sentence. That's how you challenge yourself. And how long can you do that? How long, I mean, how badly do your muscles ache? Don't push it. It needs to be comfortable. Know where your day is. Is it a good day, bad day? You know that luteal, preluteal phases, etc. Time and what kind of exercise would you like to do? Please go ahead and write your own prescription here. I invite you all to take this 2 minutes and give your prescription and share it. Share it in the group, share it here in the chats to inspire everybody else here. Okay. So my thing is, okay, I'm doing 20 minutes of yoga a day and 45 minutes of walking. My the goal I took, what somebody said here, buddy system is important, that form a group and see. So my group is, I have my classmates group, we're all going for trek in Himalayas May. So that's the goal I want, and that's what keeps me motivated. So I'm doing 45 minutes walking morning and evening, step counting, etc., etc. So I have formed these goals for myself, and it is only because I have this goal that I'm doing all this. Otherwise, even I am a lazy couch potato here. Okay, now it doesn't. To keep yourself motivated, you need to have a goal. Nilima has running for her to do that. What is it for you? Have one for yourself. So go ahead, please take your 2 minutes and write your prescription and share. So as doctors, when we choose health for ourselves, we give our patients the most powerful prescription. So with all of this, it's not just our health, we're actually giving the benefit of passing on our example to everybody who sees us in our practices. So from my side, I would really like to thank everybody here, the President, Dr. Vijay Kumar, Pavan sir, to inspire us all to do this, and everybody involved, the speakers, and most of all the audience here, all the women who have come to listen to this. Thank you for giving us this opportunity. I really hope we have been able to create some value and you take something out of this. I leave this session now open to discussion, and any questions anybody wants, if you can raise your hands, we will unmute you so you can ask.
Thank you, Dr. Pallavi and entire team for that wonderful session. I think you have given everything. You have covered every aspect of physical fitness and willpower, mindset, everything, ma'am. Nothing you have left. I think this is an awesome session, which I have one of the finest sessions which I have ever heard in the entire my medical career. Thank you so much, Dr. Pallavi, Dr. Neelma. Such an inspiring. I think we really got goosebumps when you have heard your story, how you have overcome the challenges which you are facing. So you are such a role model and inspiration for everyone. Thank you so much. Thank you so much, everyone.
Thank you, one and all. I think Dr. Pavan.
Dr. Pallavi, madam, thank you very much for bringing so many very extraordinary women. And not only that, they have shared their challenges and experiences and their success. Very thankful to you and all, Dr. Pooja, Manoj, Dr. Palak, Dr. Neelima, Dr. Anjali, and Dr. Amrita. Thank you very much, madam.
Yeah, I think everybody is left speechless, or they are very hungry for their Sunday brunch. A lot of people have left. But yes, I really invite all the speakers to please be on the WhatsApp group so that you can answer questions others doctors will pose later on. Thank you, everyone. I think I'll leave it to Dr. Pavan to conclude.
Pavan?
Yeah, hello. Yeah. Thank you so much, President Sir, for giving a great opportunity for bringing on behalf of Pediatric Academy of Telangana State. So we are greatly indebted to you for this wonderful opportunity, sir. And we thank our President and Vice President, Dr. N.L. Sir, Secretary, and Dr. RSV, and the entire EBOB of PATS 2026. And awesome Wonder Woman who have already given their special fitness formula. So both in terms of mindset, health set, heart set, soul set, all things you have covered. So thank you so much. I think we can conclude this Sunday afternoon by a wonderful inspiration from all the wonderful ladies. I think we should give a good round of applause. They deserve a standing ovation. But yeah, wherever you are, just do that and we'll conclude the session now. Thank you so much.
Thank you, everyone. Yeah.
Thank you. Thanks.
Thanks.